Welcome to our 5 on 5. Please be joined by Debbie Ameen from All Care. Debbie, good to see you. How are you today?
Nice to see you too.
All right, so we're here to talk about the Community Health Improvement Plan, also CHIP. Tell us, what exactly is that?
The CHIP program is the manifestation or the outcome of the work that's been done over the last few months in listening to the community. As you know, as part of the coordinated care organization work, we're trying to understand what the patient and the patient's family's needs are as we develop our plans to address them. And so the CHIP is the Community Health Improvement Program that is based on a lot of data, a lot of meetings that have happened across the entire region, small communities, mid-sized communities, urban, if you will, as well as rural, and in an effort to understand what people's concerns are, what their worries are as far as their health.
And these meetings, of course, happening across the state, so I'm going to ask you a very broad question here. What have you learned?
Interestingly enough, our patients and their families are very wise about what their needs are. Their priorities are, they're worried about the mental health services that they have available to them. They're worried about dental health, and they're concerned about chronic illness and the issues that are related to aging. Based on our population, based on our community demographics, those are the areas that we see as the greatest concern when we look at it from the healthcare perspective, the medical perspective as well.
Okay, so where do we go with this information now as we're learning more about the needs of our community? How do we tailor our healthcare to that community?
Absolutely. The CHIP, as we mentioned, is the plan that is coming out of the data collection, and it's a large group. The three CCOs that are representing Southern Oregon all met together, looked at the data, spent half a day discussing what are the best efforts to go from here, and identified 3 priorities areas: healthy beginnings, making sure that we're thinking about maternity issues in children and representing the needs of that population, looking at health equity, making sure that we meet the needs of all of the residents of the region. And finally is healthy living, looking at things that are a part of our life, not just the medical piece of our life, but the entire picture of a person's work, play, the diet, the exercise, all the pieces of our lives that make up our health and the picture of our health.
Very good. Okay, we're going to take a quick break.
Okay.
Much more in a moment.
Great.
Stay with us.
Thanks.
Welcome back to our 5 on 5. Again, we're here with Debbie Ameen talking about the Community Health Improvement Plan. So, Debbie, what kind of participation are you getting? What are you hearing back from people who've been part of this?
One of the things that's been pretty significant is the appreciation of people being able to participate. Having been asked the question, when we went through the process of interviewing them and then developed the summary document and brought it back to them and said, okay, here's what we heard you say. Here are some of the top issues that came up, the comments that were made. The feedback that we got was, you listened to us. And they were surprised and appreciative that we listened to them. And they truly felt as if they were participating in the solutions, that it wasn't a process of something being done to them, but done with them. And I think that's a significant part of the coordinated care organization model, is it truly is about working with the community, working with the patients and their families together to find the answers, to make the changes to improve health. And it is the way that we can truly change the delivery of health.
Sure. Okay. And now what's next? Do you still have meetings ahead, and where do we go from here?
We have a number of community meetings that are going to be happening around the region. We're listening to ideas of developing the strategy around those 3 big topic areas: the healthy beginnings, healthy living, and the health equity. What are some of the strategies? Those are big, you say the big buckets or the big rocks, and what goes underneath that? What are the specifics? And we'll be developing those. the more people that we can get involved, the more strategies that we can put underneath each of those large focus areas, the better outcomes we'll have, the better product that we'll have at the end. So as people are interested in getting involved, they can go to our website, the allcarehealth.com website. They can contact any of their local provider. They can call the All Care offices or any of the other CCOs as well, because we're working on this in a collaborative way. And just give us a call and let us know. Or I guess they could call the station. They could call you.
I could certainly point them your way,
there
Debbie.
You go.
Great to see you. Thanks for coming.
Thank you very
Appreciate
much.
It. All right, stay with us. We'll be right back.